For countless older adults suffering from arthritis, dealing with daily pain is already a tough task. Morning stiffness, inflamed joints, and the constant pain following a brief walk or spending a few minutes gardening are more than merely uncomfortable. They are draining. Numerous senior adults meticulously follow health guidelines. They adhere to prescribed medications, engage in mild exercise routines, and alter their diets to lower inflammation. However, what if, despite their diligent efforts, something presumed beneficial was in fact exacerbating their arthritis? One of the most frequently ignored factors leading to aggravated arthritis symptoms is drug interaction. No pill or supplement functions independently within the body. Particularly in older adults who may be taking several prescription or over-the-counter medications, some drugs can interact subtly yet significantly, exacerbating joint inflammation, stiffness, or swelling. In certain instances, medications prescribed for unrelated ailments such as blood pressure, cholesterol, or acid reflux might disrupt the efficacy of arthritis therapies or even provoke new outbreaks. This is particularly crucial for elderly adults who often deal with several chronic health issues. An older individual might be taking a widely used statin to control cholesterol, using a non-steroidal anti-inflammatory for joint discomfort, and consuming a regular antacid, all the while unaware that this mix could be complicating their arthritis pain management rather than alleviating it. In today's presentation, we're going to delve into 6 typical drug interactions associated with worsening arthritis symptoms. These combinations frequently go unnoticed, particularly when they include common medications or supplements that appear safe in isolation. For each interaction, we will explain its mechanism, its importance, and steps you can take to safeguard your health. Additionally, you'll listen to actual stories from seniors throughout the nation who encountered these problems unexpectedly and how they managed to improve their situations by posing the correct inquiries and collaborating intimately with their healthcare providers. This is because in managing arthritis, being informed is crucial. Often, the path to alleviation starts with a thorough examination of your medicine cabinet. 1. NSAIDs and blood pressure medications, a concealed conflict that elevates inflammation. One of the most frequent and silently detrimental drug interactions impacting older adults with arthritis happens between NSAIDs, nonsteroidal anti-inflammatory drugs such as ibuprofen or naproxen, and specific kinds of blood pressure medications, especially ACE inhibitors and diuretics. For seniors managing both hypertension and arthritis, this combination frequently goes unnoticed, yet it can exacerbate arthritis symptoms and increase strain on the kidneys and heart. NSAIDs are commonly taken to alleviate pain and decrease inflammation in arthritis. They function by inhibiting the creation of prostaglandins, compounds in the body that enhance swelling and tenderness in the joints. While this approach may offer immediate comfort, issues occur when NSAIDs are used consistently with medications that control blood pressure. Drugs such as lisinopril, enalapril, or hydrochlorothiazide work to alleviate heart strain by managing the body's fluid and sodium levels. Yet, when mixed with NSAIDs, these drugs might not function as well and, more critically, can cause fluid buildup, enhanced joint swelling, and an increase in overall blood pressure. This is precisely the case for Leonard Len Chambers, a 79-year-old retired accountant residing in Louisville, Kentucky. Len had been dealing with mild osteoarthritis for several years, frequently using over-the-counter ibuprofen to alleviate discomfort, particularly in the cooler months when his knees would stiffen. Concurrently, he was prescribed a diuretic and an ACE inhibitor to manage his high blood pressure. Initially, Len felt normal until he began experiencing swollen ankles and a persistent dull pain in his lower back upon waking. He attributed these symptoms to aging or possibly a resurgence of arthritis. However, during a standard medical examination, it was discovered that his kidney function had deteriorated. His physician determined that this was due to the ongoing use of NSAIDs together with his blood pressure medications, which had silently been counteracting each other over the years. After discussing with his physician and pharmacist, Len modified his approach to managing pain. He started to investigate non-pharmacological methods to decrease inflammation, such as taking turmeric supplements and engaging in mild stretching, while using NSAIDs sparingly and under medical oversight. Within a few weeks, the inflammation subsided and his blood pressure normalized once more. For other seniors dealing with similar health issues, Len's experience serves as a potent illustration of how one health regimen can inadvertently undermine another. NSAIDs are not intrinsically harmful, but when they are taken together with specific cardiovascular medications, they can disrupt fluid regulation and blood circulation, leading to increased joint pain rather than alleviating it. This is why it is crucial for older adults to regularly consult with their doctor or pharmacist about all their medications, both prescription and over-the-counter, particularly when addressing joint pain and high blood pressure concurrently. Grasping these interactions is crucial, as it can be the key to either advancement or regression. Often, even minor adjustments, such as staggering your medications, opting for different pain relief techniques, or changing to drug classes that are less likely to cause reactions, can greatly enhance both the condition of your joints and your overall bodily response. In managing joint pain, having this knowledge is indeed powerful. It's about safeguarding ourselves, particularly when the very medications designed to assist us could subtly be undermining our health from within. Number 2, corticosteroids and antacids, a daily combination that quietly undermines the joints. For numerous elderly individuals managing chronic arthritis, corticosteroids such as prednisone provide rapid alleviation from intense inflammation, particularly during severe flare-ups. These drugs are potent instruments in managing joint pain, aiding in soothing the immune system, and decreasing swelling that progressively harms the joints. However, what often goes unmentioned is that corticosteroids, when used alongside certain antacids or acid-blocking medications, can silently disrupt nutrient absorption and gradually exacerbate joint deterioration in incremental ways. Corticosteroids are known to disrupt calcium metabolism and diminish the body's capacity to absorb vitamin D, both essential elements for sustaining healthy bones and joint integrity. To mitigate these effects, it is commonly recommended that seniors take calcium and vitamin D supplements while on steroid treatment. However, this is where the situation becomes complex. Regular consumption of antacids, such as proton pump inhibitors like omeprazole or H2 blockers like ranitidine, can further reduce the absorption of essential nutrients. When these medications are used concurrently, particularly over extended durations, their combined effect can make bones and joints susceptible to fragility, microfractures, and heightened inflammation. This is exemplified by Florence Flo Daniels, an 82-year-old retired librarian from Sacramento, California. Flo had been on a low-dose prednisone regimen for several years to assist in controlling her rheumatoid arthritis, particularly during the colder months. Due to periodic heartburn and indigestion, her physician also prescribed her a proton pump inhibitor. Initially, it appeared to be a minor issue. However, as time progressed, Flo started to feel increased tiredness in her legs, persistent pain in her lower back, and a deterioration in her posture, which impacted her stability. Subsequent laboratory tests revealed decreased levels of calcium and vitamin D, coupled with indications of initial bone thinning. Although her arthritis seemed manageable, her bone health was silently deteriorating. Flo's physician clarified that the combination of steroids and acid-reducing drugs had hindered her body's ability to absorb the essential nutrients needed for her joints and bones. After modifying her medication regimen, transitioning to an alternative treatment for her reflux, and boosting her vitamin D levels through a diet filled with fortified foods and increased exposure to sunlight, Flo observed a steady improvement. She also added more weight-bearing exercises to her daily activities to preserve bone density without exacerbating her arthritis. This narrative is not rare. Numerous older adults depend on both corticosteroids and antacids without understanding how their interaction can affect joint health. Both drugs have essential purposes. Corticosteroids combat inflammation, and antacids alleviate digestive issues. However, when used together over extended periods, they can subtly exacerbate arthritis symptoms and elevate the risk of osteoporosis. For older adults dealing with multiple health issues, it's important to consider not just immediate symptom relief, but also the long-term impacts of using multiple medications. If you or someone you care about frequently takes corticosteroids and acid blockers, it's advisable to talk to your healthcare provider about monitoring bone density and adding nutrient supplements. Some straightforward changes, be they in diet, medication, or lifestyle, can safeguard your joints and bones from slow deterioration that may not become apparent until significant damage has occurred. Ultimately, managing joint pain isn't just about alleviating today's inflammation. It's about maintaining your strength, mobility, and independence for the future. 3. Statins and muscle pain. When cholesterol medications mimic arthritis symptoms in their quest for cardiovascular wellness, statins have emerged as some of the most frequently prescribed drugs for older individuals. These medications are effective in lowering cholesterol levels and decreasing the likelihood of heart attacks and strokes. However, many seniors may not be aware that these drugs can also sometimes induce side effects that mimic or exacerbate existing arthritis symptoms, particularly when combined with other medications that influence muscle function or liver metabolism. Statins, including drugs like atorvastatin or simvastatin, function by inhibiting an enzyme in the liver that is crucial for cholesterol production. While this process safeguards blood vessels, it may also disrupt the synthesis of coenzyme Q10, CoQ10, an essential compound required by your muscles for energy and function. A decrease in CoQ10 levels can lead to muscle pain, fatigue, and stiffness. These symptoms are frequently misinterpreted as an arthritis flare-up or just typical aging. The issue becomes more complex when statins interact with other medications such as some antibiotics, antifungals, or even grapefruit juice, which block the liver enzymes that break down statins. This interaction can increase the amount of statins in the bloodstream and heighten the muscle-related side effects. Consider the case of Warren Woody Ellis, a 76-year-old retired firefighter from Tampa, Florida. Woody had been taking a statin for more than 10 years without significant problems until his physician prescribed an antifungal drug to treat a slight skin infection. Shortly after starting the medication, he noticed an uncommon stiffness in his legs and lower back, which he first thought was just his osteoarthritis flaring up. However, this pain was different from the usual joint discomfort. It resembled a persistent muscle fatigue. He also observed that his legs were weak when ascending stairs, and his balance appeared compromised. A subsequent appointment and laboratory tests showed that the antifungal treatment had disrupted how his body metabolized the statin, causing elevated levels that impacted his muscles. Under his doctor's advice, Woody temporarily discontinued the statin, changed to another antifungal, and later resumed the statin at a reduced dose with additional CoQ10 supplementation. Within 7 days, his stiffness started to lessen and his vitality came back. Drug interactions like this are more frequent than many realize. For older adults dealing with both heart health and joint issues, the overlapping of symptoms can be perplexing and often misunderstood. Muscle discomfort caused by statins may not always resemble the usual arthritis pain. However, when mixed with other medications, it becomes difficult to distinguish, causing some to assume their arthritis is merely worsening. This is why maintaining transparent communication with healthcare professionals is crucial. If you experience new or unfamiliar muscle pain, fatigue, or stiffness upon beginning a new medication, or if your typical arthritis symptoms seem altered, it's crucial to consider the possibility of drug interactions. Your physician might recommend blood tests to evaluate muscle enzymes, modify your dosage, or change your medications entirely. Effectively managing joint pain while dealing with other chronic conditions requires recognizing that each medication can have a ripple effect. Occasionally, what appears to be arthritis might instead be your body indicating a more profound imbalance, one that can be addressed with proper awareness, timely interventions, and adequate support. By taking an active and knowledgeable approach, older adults can manage intricate treatment strategies without compromising comfort or mobility. Moreover, with appropriate advice, you can safeguard your joints, your muscles, and your overall well-being. Progressing step by careful step. 4. Diuretics and gout flares. A water pill capable of triggering joint attacks. For numerous older adults, diuretics, commonly referred to as water pills, are a standard component of treatment for high blood pressure or heart failure. These drugs aid the body in removing extra fluid and sodium via urine, which decreases the burden on the heart and reduces blood pressure. However, despite their crucial function in maintaining heart health, diuretics can also lead to a surprising and painful issue for individuals suffering from arthritis, especially a type known as gout. Gout is a form of inflammatory arthritis resulting from an accumulation of uric acid crystals in the joints. Elevated levels of uric acid in the blood can lead to the formation of these sharp crystals, which often lodge themselves in areas such as the big toe, ankles, knees, or fingers. This results in sudden, severe swelling, redness, and sharp pain in the joints. Unfortunately, some diuretics, particularly thiazide and loop diuretics, may impair the kidney's capacity to properly remove uric acid. This results in elevated levels of uric acid, substantially raising the risk of gout flare-ups. Take the example of Darlene D. Kruger, an 84-year-old retired florist from Mobile, Alabama. Dee had been on a diuretic for numerous years to control her blood pressure. Initially, all appeared well until she unexpectedly started to suffer from severe pain in her left foot. At first, she thought she had sprained it. However, as the swelling intensified by the next morning and her skin became red and warm when touched, she realized there was a problem. Upon consulting her physician, she learned she had gout, a medical issue she had never encountered previously. It emerged that the diuretic she was taking had been promoting an increase in uric acid levels in her body. Once her doctor identified the issue, they updated her treatment strategy, transitioning her to an alternative blood pressure medication that had less impact on uric acid levels. She also modified her diet to reduce the intake of purine-rich foods such as red meat and shellfish, and started on a low-dose medication to manage her uric acid levels. Since implementing these adjustments, her arthritis symptoms have improved significantly, and she has not had another gout attack. This kind of medication interaction is particularly significant for older adults, because gout can often be mistaken for other types of arthritis. Many older individuals might think a sudden flare-up is simply their osteoarthritis getting worse, when it might actually be a preventable increase in uric acid caused by their current medications. Therefore, it's crucial to consistently review your prescriptions and maintain clear communication with your healthcare provider, especially if you experience new joint pain that emerges abruptly and deviates from your typical symptoms. For individuals who have experienced gout or unexplained episodes of arthritis, conducting a regular blood test to measure uric acid levels can be highly informative. Fortunately, minor changes in medication and dietary habits can frequently diminish symptoms, eliminating the need for a comprehensive revision of your current treatment strategy. In the intricate task of managing joint pain, medications that benefit one aspect may complicate another. However, through increased awareness, tailored advice, and consistent monitoring, older adults can achieve a balance that promotes both cardiovascular and joint health without having to compromise one for the other. Additionally, antidepressants and sleep aids play a role. Sedation often conceals inflammation affecting numerous seniors, linking emotional well-being and physical comfort closely together. Conditions such as arthritis not only influence the joints, they also affect sleep, mood, and energy levels. It's quite common for older adults suffering from chronic arthritis symptoms to also suffer from insomnia, anxiety, or mild depression. To address these issues, physicians might recommend antidepressants or medications to aid sleep, seeking to reestablish equilibrium, restfulness, and emotional strength. However, what is often not highlighted is the potential for these drugs to interact with each other and with treatments for arthritis. These interactions can suppress the body's inherent reaction to inflammation or even postpone vital diagnostic procedures. Specific antidepressants, especially selective serotonin reuptake inhibitors, SSRIs, along with frequently used sleep aids such as zolpidem or trazodone, may lead to side effects like muscle rigidity, joint pain, or agitation. When used in conjunction with medications for managing arthritis, like corticosteroids or NSAIDs, the sedative effects of these drugs can occasionally conceal early symptoms of an arthritis flare. This can delay recognition, hindering prompt modification of treatment and letting inflammation intensify unnoticed. Moreover, some of these medications might disrupt how liver enzymes metabolize arthritis drugs, resulting in diminished efficacy or accidental accumulation in the bloodstream. Consider the example of Stanley Stan Holbrook, a 77-year-old retired pharmacist from Syracuse, New York. Following the onset of continuous joint pain in his hands and lower back, he was diagnosed with early-stage inflammatory arthritis. To aid his sleep throughout the night, his physician prescribed a low-dose antidepressant recognized for its sedative properties. Initially, Stan appreciated the extra sleep, but eventually he started to wake up feeling more sluggish, experiencing persistent stiffness in his shoulders and knees that lasted until the afternoon. He also observed that his pain medications were less effective and he was unable to pinpoint the exact source of the inflammation. Upon discussing his medications with his rheumatologist, Stan discovered that the sedative was numbing his pain sensation and simultaneously affecting the way his body processed the anti-inflammatory medications. After the antidepressant was gradually reduced and substituted with alternative approaches, such as mindfulness meditation, the use of a weighted blanket, and a melatonin supplement, his alertness was restored. He was once more able to recognize when his joints required care, and his treatment strategy significantly improved. This type of drug interaction does not concern danger in the conventional sense. It's a matter of delicate disruption. For older adults dealing with arthritis, identifying flare-ups promptly is vital for controlling long-term damage. If a medication, including those that aid in sleep or alleviate anxiety, starts to dull this awareness or alter how the body handles other medications, it can result in unforeseen complications. Joint damage isn't always obvious. It can be subtle, slow, and easy to overlook if your senses are numbed by sedation. This is why it's crucial to treat the entire person, not just the pain or the stress. Collaborating with physicians who recognize the interconnectedness of emotional and physical health, particularly in seniors, is crucial. If you or someone close is using sleep aids or antidepressants while also dealing with arthritis, it's important to consider how these medications might affect not only sleep and emotional well-being, but also the management of joint pain. The objective is not merely to ensure a full night's sleep, but to ensure you wake up feeling stronger, more lucid, and more responsive to your body's daily signals. Number 6, herbal supplements and prescription medications, when natural, isn't always safe. Lately, a growing number of seniors have started using herbal remedies and natural supplements as part of their self-care routine, aiming to decrease inflammation, enhance immune function, or increase energy levels without depending entirely on prescription medications. And although many of these supplements can provide genuine advantages, they are not devoid of risks, particularly when taken in conjunction with medications for arthritis or other chronic conditions. One of the most ignored drug interactions that can exacerbate arthritis symptoms doesn't come from a prescription container, but rather from the vitamin or herb section at the local pharmacy. Supplements like turmeric, ginseng, garlic extract, St. John's wort, and even fish oil are frequently promoted as natural anti-inflammatories. While this might seem beneficial for individuals dealing with joint pain, the reality is somewhat more intricate. These compounds can disrupt how the liver processes arthritis drugs, either by accelerating their breakdown, thus diminishing their effectiveness, or by causing their concentrations to surge excessively in the blood, amplifying side effects such as stomach discomfort, dizziness, or liver stress. Additionally, certain supplements function as blood thinners, potentially heightening the likelihood of bruising or internal bleeding. Particularly hazardous when coupled with NSAIDs or corticosteroids, which are frequently employed in managing joint pain. This became a painful lesson for Clarence Clay Weston, a 73-year-old retired school principal from San Diego, California. Clay had been diagnosed with psoriatic arthritis a few years prior and was on a low-dose immunosuppressant medication prescribed by his rheumatologist. In an attempt to use less medication, he started incorporating turmeric capsules and concentrated garlic extract into his daily regimen after learning that they might naturally lessen joint inflammation. Initially, he was optimistic. He noticed a mild improvement in his morning stiffness and valued the approach of adopting a more holistic strategy. However, within a few months, Clay started to feel unusually tired, dizzy, and often suffered from indigestion. A standard blood test showed raised liver enzymes and fluctuating levels of his prescribed arthritis medicine. Following a detailed discussion of his supplements with his doctor and pharmacist, it was evident that the herbal products were affecting his liver's enzyme systems and changing the way his arthritis medication was metabolized. When he stopped taking the supplements and went back to his initial medication regimen, now with more careful supervision, his symptoms became stable and his energy levels improved. Clay's situation is not rare. Many elderly people believe that if a product is natural, it must be harmless. However, just because something is natural does not guarantee it is without side effects, particularly regarding interactions with medications. Common nutrients such as vitamin E or high doses of fish oil can thin the blood or modify how drugs are metabolized, especially when consumed in large amounts or mixed with specific prescriptions. For seniors dealing with arthritis, the goal should not be to eliminate supplements entirely, but rather to utilize them carefully and under medical guidance. Prior to incorporating any new vitamin, herbal supplement, or over-the-counter item into your regimen, it's essential to consult your healthcare provider or pharmacist. Inquire about potential interactions with your existing medications, any impacts on your liver or kidney function, and the appropriate dosage for your specific health condition. This is because maintaining joint health isn't only about what you consume, but also how all the supplements and medications you take interact with each other. With numerous elements at play, even the most intentional decisions can have unintended consequences if they are not integrated into a comprehensive, informed care strategy. Ultimately, safeguarding your joints is about safeguarding your entire system. This is achieved by making choices rooted in understanding, open communication, and trust, rather than merely by what seems apparent on the surface. For many older adults suffering from arthritis, coping with daily pain can seem like a full-time job. However, as we have discussed in today's video, what makes managing this condition even more challenging isn't only the disease itself. It's also the covert drug interactions that silently undermine your efforts. From familiar pairings such as NSAIDs and blood pressure treatments to the less obvious effects of antidepressants, statins, and even herbal supplements, the influence on arthritis symptoms can be significant, yet easily missed. The most hazardous aspect of these interactions is not their overt severity, but how silently they occur. A minor rise in joint stiffness, a shift in morning fatigue, or a new pain in an unexpected area might not initially appear concerning, but these subtle changes can accumulate over time, compromising the efficiency of your joint pain management strategy and resulting in unnecessary discomfort or chronic complications. Therefore, awareness is your best protection. Realizing that every medication you use, whether it's prescribed, bought over the counter, or natural, has the ability to affect your arthritis, is the initial step towards enhanced management. This isn't about being scared or shunning treatment. It's about being informed and proactive in your care. If you're on several medications and have observed recent changes in your joint sensations, discuss this with your doctor or pharmacist. Request that they examine your complete list of medications. This is important not only for safety, but also for effectiveness. Numerous problems can be resolved through minor adjustments, such as modifying dosages, changing medication categories, or altering the timing of doses during the day. And remember, your body constantly communicates with you. If something feels unusual, no matter how minor it might appear, pay attention to it. Discuss these changes with your healthcare team. Every action you take to comprehend and modify your treatment strategy is a move towards enhanced comfort, mobility, and independence. If this video illuminates an issue you've been facing, please share your thoughts in the comments. Remember to like, share, and subscribe for further advice on nurturing your body with care, gentleness, and thoroughness. Because when you understand what to observe, you acquire more than just relief. You gain control. The control to safeguard your joints, your health, and your tranquility.